This episode includes discussions about suicidal thoughts, depression, and the profound impact of testicular cancer on mental health. Hello and welcome to Check 1 2, where we give you the lowdown on testicular cancer by talking to survivors, advocates and supporters of testicular cancer awareness here at the world famous Podcast Studio Glasgow. So on today's episode, I'm excited to speak with Dan Matthews, who is here to share his powerful story after being diagnosed with testicular cancer over 10 years ago and his incredible journey that followed. In this episode, we dive into the physical, but more importantly, the emotional and mental challenges that came with diagnosis and treatment of testicular cancer. We also explore the long-term effects of survivorship and the role in mental health and the gaps that still exist in supporting testicular cancer survivors.
I'm Dan Matthews. I'm based down in Essex, and I work in London, so right down in the southeast of England, quite a few miles away from where you are.
Yep.
So hence why we're doing this virtually, aren't we? I had testicular cancer in 2011, so it's quite a long time ago now. And I found it really completely by accident. And I mean, like, when you listen to your previous two guests that are doing so much for awareness, I was just completely head in the sand at that time about it. It didn't even come into my mind. I literally was getting pains in my groin. And I didn't even think at one point that it could have been that. Went to A&E one night and they go, oh, and they didn't even scan me. They just went, oh yeah, I think you've got some infection. Here's some antibiotics, go away, whatever. I was like, okay. So I took them and it kind of subsided a little bit. And it all went away. Then they sent me a letter to have a follow-up appointment to have an ultrasound, and I went, I don't need that. I feel fine. So I cycled up there because at the time I was doing quite a lot of riding, quite a lot of exercise, felt fit. Went up there, had an ultrasound on my right testicle, had a little line through it, and the guy goes to me, yeah, that looks damaged. This is what a healthy one looks like. And he went over to the left one, and as he went over to the left one, there was a massive, great big black lump in the middle of it, and he kind of stopped mid-sentence and went, this is what a healthy one look. Oh, okay. That doesn't look right. No pains or anything from the left one. It was all the right one, and he was just showing me the left one to show me what a healthy one looked like. And he went, I'm just going to go and get my colleague. You wait there. Like you do, all gelled up, just laying there, nothing on. And they come back, had a look and went, yeah, well, what are you doing this afternoon? You doing anything? Can we go and see another colleague at the oncology department? And I went, and it's only when I went there and I went, oncology? Oh. So I went up there to see them and then did a load of bloods, come back the next couple of days with my wife for follow-ups, and I think literally 5 or 6 days later I was having an orchidectomy on my left one. So it all kind of happened really, really quickly once I'd found it. But I felt embarrassed afterwards because I just was so head in the sand. I just hadn't even thought that that's what that could be. Just, yeah. But there you go. It was stage 1. I had that, and I had some... one shot of carboplatin about a month and a half later, because I think there was something in my blood still or whatever. So it was, so I got lucky that I had found it really early, and I'm very grateful for that. That was amazing that I'd found that so early. Well, we were talking about this the other day. We actually went away in between my orchidectomy and my chemo. We had a holiday booked. We just went to Spain with the kids, and I was at the airport having just had an orchidectomy a week before. Didn't declare this to the insurance company or anything. You don't need to know about these things. My wife's struggling with the suitcases, and of course, a week after an orchidectomy, you're not lifting a 20-kilo suitcase, are you?
No.
Getting some really bizarre looks from people looking at me like, oh, he's got the missus well trained, are they? Look, he's not doing anything. I was so sore. I couldn't even lay down flat at this point, and I'd gone on holiday without even... It's probably a little bit... But you don't think straight. During the middle of that, you just don't think straight, do you? You just I just want to get away from all this shit. Sorry, shouldn't swear. I just want to get away from this. The kids are upset because... my kids at the time were 5 and 3, and my eldest, my boy, he kept saying to my wife the fact that he'd seen me go into hospital and I'd come out in a worse state than I went in. He didn't understand. You go to hospital to get better. You don't go to hospital and then come out looking worse than when you went in. Yeah. Because, he couldn't get his mind around that, and he started wetting the bed and he started playing up a bit and, reacting to the fact that something was wrong, but he was too young to understand. you can't tell a 5 and a 3-year-old what cancer is, can you? They're not going to understand that, So yeah, we did that. I had some time off work, went back to work in a sort of staged, a few days a week, because I was working full time in London at the time, so commuting into London. Started to feel sort of all right. I mean, this was July 2011. Got past Christmas, still all right, and then early 2012, the wheels just completely fell off, just completely. But it turns out that the pain I was having in my right testicle was the sign that my right testicle wasn't doing anything. So when you lose the left one, it took my body a few months to catch up and then go, there's no testosterone anymore in here, is there? And I just felt absolutely, yeah. And that was quite weird, especially with my colleagues, because suddenly it was a bit like, oh, well, you've been coming back to work and you've looked fine. So what's the problem now? You know what people are like with invisible illnesses.
Mm-hmm.
So that's when, when you look back now, the actual cancer diagnosis, the orchidectomy and the chemo was the easy bit. The next 6-7 years after a testosterone ran out was the horrible bit, and that's what I try and talk to people about, because it's the after effects. My cousin had testicular cancer 10 years before I did. Excuse me.
Okay.
And he had operation. He didn't have chemo. They caught it so early. They didn't even give him chemo, and he just bounced straight back. He just no testosterone problems, no nothing. So it just shows you what happens when people have cancer, and I think that's what my colleagues at work thought was going to happen. He's back at work now. Look, it's all fine. And then it was just awful trying to get. I mean, I know a lot has changed now around testosterone, but at that time, the testosterone was just, my GP wasn't interested. The oncologist wasn't interested. It was all just, this is all in your head. This is all, you're still suffering from the chemo. You're still suffering from the shock of having cancer. And just got really, really fobbed off. No, it just felt like there was doors closed in your face the whole time. You talked to doctors and they just wanted to get you out as quick as possible, or get you on antidepressants, or it was just an awful time trying to get treatment. And it took me 18 months before I actually was sitting in front of an endocrinologist to actually talk about this, by which point my testosterone level had gone down to literally the same as like a 90-year-old man. It was down to something like 3. And my hospital had a testosterone level rating on the blood test from 6 to 28.
Mm-hmm.
And because it was still, the phrase at the time that, it still gives me a little bit of a, just thinking about it, was you're in the normal range. I hovered on 6.5, and the bottom of the range was 6 for about a year. And every single time I talked to anyone, it was, you're in the normal range, you're fine.
Yeah.
Despite the fact I was sitting in front of them saying, I'm literally suicidal. I struggle to get out of bed in the morning. I'm so depressed. I just don't want to be anywhere. I'm agitated. I was getting to the point where I was travelling into work on the train. I was sitting on the train in the morning. I was crying on the way in there because I didn't want to go to work. And then on the way home, I was sitting on the train because I didn't want to go home. I didn't want to be at home with the kids, a wife. I didn't want to be in work. I didn't want to be anywhere. I didn't know what to do with myself. And the doctors and hospital were just uninterested or didn't understand.
Yeah.
And it was just absolutely awful. And it was not and very difficult for my poor wife as well, but she was still managing with the young kids and having to manage with me. So that's something that I've with the CNS nurse at the time, we started a testicular cancer support group based out of Barts in London, because at the time that I was going through this, I was desperate to talk to other men about this, but couldn't really find anything. There wasn't really much online. There was I think at the time there was like Checkham Lads, I think was a big one on Facebook at the time. But there wasn't much information to talk to people. There wasn't many people doing things like you're doing, talking to different survivors, and there just didn't feel like there was any sort of way to reach people that were, is this normal? Am I going through something that's normal? So it's a very lonely place when you're like that and wondering why you're feeling that way, and if low testosterone does this, and then trying to get treatment, and why can't I get treatment? Why is there no one interested in helping me? But it seems like the testosterone in men and the fact that a number of people do suffer from this afterwards is being looked at, and more there is more awareness around it now,
Yeah.
which is fantastic.
Well, recently we were at, I say recently, it was probably last year, we were at the Germ Cell, National Germ Cell Conference at the Edinburgh International Conference Centre, and I was sitting kind of front and centre because, you know, our TCN community were going up and delivering like a kind of a speech as such to say thanks for inviting us, and this professor went up on stage and he kind of laid out this patient, like kind of this fake patient subject thing that was going on. And the way that he talked about it, it was basically about testosterone in like post orchidectomy patients, like X amount of years after having had an orchidectomy and chemotherapy. And I was sitting there and I was going, that's me. He's talking about me, because everything that he was detailing, like low mood, you know, like weight gain even though you're maybe exercising, lack of motivation, lack of sex drive, all these things were getting brought up, and I'm like, wait a minute, like I understand everything that's happening here. And much like you, I had been to the GPs and, you know, talked about this, and it was always just kind of put down to, like, you've had a traumatic experience. It's probably just depression and anxiety. And, you know, at this point, I've just, and I'm going to be 9 years, I've just got to the point now where I'm going to see endocrinology, you know, but again, that's going to be another maybe year before I do that. But I had to fight tooth and nail to see that, because there is still that stigma around not only mental health, but mental health of guys after, you know, testicular cancer. I agree with you. I think you're kind of, and I've said this a couple of times, see, when you're in hospital, when you're getting your treatment for your physical health, I can't fault anybody.
No.
There's, you know, I couldn't fault the staff. They were amazing. But see, when you were done, and then suddenly months later you go by and you're sitting in the bath, like, not feeling sad, just feeling numb and nothing. Horrific, you know. So I completely understand, you know, that to a degree of how you felt as well. You know, it's horrible. And like my son and your eldest was roughly the same age, and a similar experience. I remember coming out of surgery in that grey pallor, and my son just looking at me, going and saying to, like, my wife, like, Dad doesn't look great, it doesn't look well, and you're meant to go into hospital to get better, but I came out looking worse. So yeah, a strange old experience, you know.
Yeah. No, it's and the problem as well, I think, is that with the testosterone treatment, because it's so different in different men, the getting in front of someone, I don't know where you are on this now, if you're actually having testosterone treatment, are you now?
No, not yet. No.
Is that there's multiple different types, and they start you on the gel and see how you get on with that. And I just didn't get on with that at all. I just, it just made my skin feel really itchy. I used to have quite bad eczema when I was younger, and I think it just agitated my, you know, wherever I put it on. I tossed gel, I think it tossed gel, and Tostran.
Yes,
that's
yeah,
Tostran.
yeah.
It was in a little container with a little pump on the end. That's it. Yeah, Tostran, and it just used to make me feel really sick. So they only put me on that for a little bit, and then they said, "Oh, what we should probably do is get you on the Bedo, which is the big injections, you know, every 12 weeks." And I was on those for about 3 years, and that made me feel. I actually got to the point when I was actually wanting to go back to having the low testosterone, because what I was doing is I was having a massive, great big spike, and the too high testosterone feeling was almost as bad as the low testosterone feeling. It was just, and I was going to the point of having these injections every 12 weeks, and I was feeling awful for 4 or 5 weeks. Then they'd get to a little plateau where I'd start feeling, you know, I don't feel too, but it's just sort of almost like that, you know, with that sort of hangover's wearing off, and you start going, oh yeah, I'll start feeling all right now. I could maybe try eating again or something. You know what I mean? That sort of feeling. And then all of a sudden it would go, no, now we're going downhill to the low testosterone feed. So I'd get to a 12-week cycle and I'd be feeling rubbish for 3/4 of it. And I just went back to him and said, that's not right, is it? You know, I
Yeah,
should be.
it's not a way to live as well.
No, it's not. And I was getting to the point where I was actually dreading having the injections because I knew that after the injections I'd have this. And I was getting to the point that my blood was getting so thick, I was actually getting sort of like, you know, thick blood from it as well, which is, you know, quite dangerous. I didn't really fancy having a stroke at, you know, late 30s. Just give yourself a stroke, you know. So, you know, so it's I was on that for a little while, and again that. During that period of time with those ups and downs and that high, that's when I started having. I mean, I literally had 2 episodes when I went out of the house and I didn't want to come back again with my kids. You know, even thinking about the kids, I just hadn't. Because by this point, this is. I did write down some numbers afterwards. Yeah, this is you know, 4 or 5 years after I had cancer.
Yep.
You know, so we're not talking about a small. You've been living like this for 6 months or a year, and I've been living like this for a long time, and it just got to the point I wasn't functioning well at work. I just was not functioning well at home. I just had no patience. I had no, you know, and it was just I just get to the point where you're like, you can do this for a little while, and then in the end you just get absolutely worn out, and you get worn out just putting that smile. Oh, yeah, I'm fine when you're at work, face on, don't you? And I just felt dreadful all the time. Do you know what I mean? And you get to that point where you wake up in the morning, and as soon as you wake up, you're like, oh, here we go again. I've survived another night. Oh shit, I've got to go and do this again. And I literally was feeling like that. And I walked out the door twice with the intention of not coming home again.
Yeah.
And that's not a good place to be.
No. And was that, and with that intention, was that like, you know, were your kind of thoughts of suicide chronic at that point, or were you just feeling?
Once they were, yeah. Once I just went and I pretended I had to go and get something from B&Q. I mean, my wife should have been suspicious at that point anyway, because I never liked going to B&Q, so she must have been suspicious. And I'd literally parked as far away from the car park and the shop as possible, and I sat in the car for 2 hours and just cried my eyes out.
Yeah.
And I just didn't want to go home. I just sat there. I just didn't want. And the other time, I was just sat by a railway line, just watching trains going past. And the farmer come walking over and asked me what I was doing. Train spotting, obviously.
Yeah.
And
not the movie.
No. Well, at that point, that's probably what I needed, a wee dab of speed. That might have done the job, to be fair. But yeah. But it was just, it was.
And how did you? And did you at that point? You know, you've had those two kind of separate instances of kind of walking out of the house, and what brought you back home? What made you start the car and go home at that point? You know, feeling the way that you were feeling.
I think it's. I think it's not having. I don't know. I've thought about this quite a lot over the years. I think it's not having the bottle to go through with it completely. It was a. I think there's a distinct difference between I don't want to be here anymore and actually going through with the act. I think that's a kind of almost like a next level up, I think, isn't it? And I was kind of not quite ready for that next level up, although I just didn't want to be anywhere. And I think it was, I think I just sat and I think I just wanted some space. I think you just get to that point, you're tired, and you know it's like when the kids are young, you just feel like you're never going to get out, you never get any space, and you have, you know, as much as my wife was so understanding and amazing, you always feel when you're in this state, whether you're at work or at home, someone's watching over you all the time because they're worried about you. But at the same point, you kind of feel like you're, are you all right? Are you all right? Are you all right? Yes. Stop asking, please. I've had no. Yeah. You feel like you're constantly under, but yeah, to answer your question, I think I was thinking about my kids.
Yeah.
And I don't know whether that was, I don't know, the selfish thing to do and not leave them in that position and leave my wife in that position. and just the hope that something would get better one day. Yeah, but I think that was the main thing. I think it was, to be fair, it was the kids. But then on the flip side of that, when I'd sat there thinking about them and thinking about how they would react if I did that, I got to the point where I actually, for a little while afterwards, actually got even more angry at them because I resented them for having that thought in my head that stopped me doing that.
Right. Okay. Yeah.
If that sounds weird.
No,
But
it doesn't sound
but it
weird
was
at all,
but it was
but yeah.
that sort of, just thinking about when they're playing up, when you're like, got this horrible feeling in your head of like,
Yeah. I think that's the thing as well. Like, nobody can really understand the complexities of intrusive thoughts like that as well.
Yeah.
You know, it's you don't necessarily feel it, but it's the thought that you have in that moment, feeling the way you feel, and
yeah.
And I think that's probably the big thing that isn't talked about as much. And I've tried to, in this podcast, kind of, go into it, and I think it's still, even with testicular cancer survivors, I think there still is a stigma around our mental recovery with that as well.
Yes. Yes.
And obviously when I had we had spoke and we were arranging this, I'd kind of researched your story and things like that, and knowing that you've been quite open about the kind of mental health aspect of it as well. That's been a kind of drive. It's refreshing in a sense to this be another really quite open conversation about this, and I think it can only add to what we as Cahonas are trying to do in terms of a library of different things that guys go through. And from my own perspective, I've had the same type of thing. I think my mental health has suffered, one, just because of the trauma of the being told that you had cancer, losing a testicle, the kind of crux of that. But that low testosterone thing, and I'm much in the same position as yourself. Every time I've went to doctors going, right, I've tried this, and this. And then it was only after I went to that conference, the germ cell conference, that I went, right, I've heard this professor talk about this, and this is what he described me to a T. You have to help me with this, because I think this is what's causing me to need to be on antidepressants. I fluctuated between, it's sertraline that I'm currently on anyway, and I fluctuated between 200 milligrams, which is your dose, dropping down to the 50 milligrams, and then just fluctuating it up and down, because it's not necessarily like the serotonin that's the problem. There is something else going on, and trying to explain that to your doctor, you've obviously faced the same issue, and it's really hard to go, honestly, like, I'm telling you, I'm knowing my body, there's something not right, and it's not just that I'm depressed. And so when you eventually got that conversation with your doctor, how did that turn? How did that go from, no, your levels are quote unquote normal, to no, let's start you on treatment? How did that switch happen?
That switch purely happened because of the fact that my testosterone got so low it dropped out of the range completely.
Right.
That's the only reason why I got treatment, because the normal range that our hospital were looking at was 6 to 28, and at one point I had a blood test and my testosterone was 3.
Yeah.
So the blood test had a little red mark on it to say something's not right here.
Yeah. And do you think then that, do you feel let down at all that, you were saying this and it took to that complete drop before anything was done? Do you feel let down in that way?
Yeah.
Yeah,
completely. And it was, unfortunately, it was just a lack of knowledge of men's hormones. That's purely what it was. And the fact that the oncology doctor that I saw when I first got diagnosed with cancer, she was in the process of retiring. So after she retired, I then saw a number of sort of locum doctors, and I went for a phase for about a year. Every single time I went for the 3-month checkup, they just do your bloods and have a look at your chest x-ray, your CT scan, and they go, yeah, that's all great. They weren't very interested in doing anything, and I saw literally 4 or 5 different people over the course of a year and a half, which none of them would commit to wanting to do anything with the hormones because they didn't really understand the hormones enough.
Yeah.
So I'd give them the like you say, the symptoms, and they weren't matching the symptoms to the you are a little bit on the low side. I mean, a couple of them even commented, yeah, it's low, I can see that, but it's still in the normal range. And then there was the lack of wanting to commit to it. And one even told me, and I remember this clear as anything, and I think I just burst out laughing, and he looked even more angry, because it's like when you actually try and ask a doctor questions or try and tell them something, they just look at you like, how dare you, don't they? And he said testosterone causes prostate cancer. So that's the level of ignorance that I was dealing with.
Yeah.
Do you know? And that's why he told me he wouldn't refer me on to have that.
Yeah. It's so frustrating as well. It's like, and we talk about this in terms of even like guys going to the doctors for their testicles, but out with that, you've had this problem, and there's still this, this issue with guys going, right, I don't think I'm feeling right. And all it does is perpetuate that, okay, I'm not going to go back to the doctor then, and then you end up in this situation where you're driving to B&Q and sitting in your car because you've ran out of ideas, nobody's listening. No. And I'm, again, you're very much in the same position, in this last kind of year or so where, I've eventually sat down and went, you have to listen to what I'm saying to you. And the paper that is out there, it talks about, symptomology versus like blood work and stuff like that. So all the symptoms that I'm feeling, indicate low testosterone, even though my blood work doesn't show that. However, that this paper is to say, like, was basically kind of like to, I'm not a doctor, so I don't know. I'm going to sound really stupid, but it was to kind of make sure that people understood that this symptomology and what you're seeing from test results doesn't always marry as well, because of guys who have had an orchidectomy and went through a chemo or radiotherapy, and trying to get like my doctor to listen to that, it was really frustrating. And I ended up having to, and I was really lucky that I was in contact with my oncologist because of Cahonas, and the work that we were doing with the beats in west of Scotland. And I was able to just email Dr. White and say, listen, this is what's going on. He phoned me, spoke about that conference and everything, and he went, well, everything you're telling me sounds right. So, and then he eventually, before he retired, went right and put a referral into endocrinology for me.
Oh, wow.
And it's, it was just that weight of, right, a doctor agrees with me that there's something not right, and I'm not going crazy, even though I feel like I am going crazy.
Yeah.
And so hopefully in the next 6 to 9 months I might see endocrinology and have that start, because at the minute I still feel I'm at the point now where I'm like, even this morning I'm going, I need to get, I've got a doctor's appointment booked to speak about my mental health, but even this morning I'm going, I can't just wait for that appointment. It's 2 weeks' time. I need to speak to somebody now. To do something, and it's hard. And I'm sorry I've ended up gabbing on.
No. It's good. It's good. It's interesting seeing how different people's point of view and how how the hormone affects the mental health. That's the most important thing. It's you start getting all those multiple symptoms, and it can't not affect your mental health, can it? I know this is a really rubbish analogy, but someone's got I had my wisdom teeth taken out when I was younger. I mean, that affected my health for a few weeks because I just couldn't think straight. And that's a physical thing. You can just go, there you go, have an operation. There, all 4 of your teeth are out. Job done. But with this, it's invisible, isn't it? And no one wants to help you fix it. And it's the lack of, I don't know, it's a lack of understanding. I mean, I eventually got to see an endocrinologist purely because my stream of locum doctors suddenly turned into I'm going to see who is he was called Dr. Hamid at Chelmsford Hospital, and I eventually got to see him, and he was and the first appointment I had with him, he literally looked at me and went, your testosterone's too low, I need to refer you to an endocrinologist. So I literally had an oncology doctor that understood hormones, and that was the first thing he said to me when I first had an appointment. And I was just like, oh wow, this is just bloody brilliant. And then the next conversation I had when I walked into the endocrinology guy and saw him, and he went, "Oh, you've been low. I treat any man that's the range is under 12, right? And I'd been for 18 months hovering 7, 6, and then it's only when I got dropped down to 3 that the alarm bell started ringing." And he said to me, I didn't know whether to laugh or cry at that point. You know, it's like when you see the right person, they immediately recognise that it's the matching the symptoms to the lowness. It might be in the normal range, but why not look at the patient's history? You've just had testicular cancer, you've lost one, this might affect the other one. Look at the symptoms that go with that, you know, patient history and your current symptoms, and then match them to the low testosterone, not just look at the numbers on the bloody page.
Yeah.
Oh,
I think that's the biggest problem, It's like, it's they're looking at these numbers. I'm bouncing between 9 and 11, you know, like on a good day. You know, it's maybe been an 11, but I think one of my fasting bloods was down at 7, you know, and I'm like, and when you hear that, it's like you hear, oh, no. In fact, the very first time that I got my results back, and God bless them, they're only doing their job, but it was, you know, you sometimes get a phone call to say, this is your results, and it's the GP receptionist, you know, saying, I've just to phone you to tell you your blood results are normal. And it's like, well, what does that mean? You know, what does normal mean? Because I don't know that. I'm not a specialist in that. So, and then unfortunately they can't answer that. So then it becomes this vicious circle of trying to chase down what that normal is for you.
Yeah, exactly. Yeah. Because you don't know what your normal testosterone level was before you had cancer, you don't really know what your own normal is anyway.
Yeah.
Because every person is different. You might have someone that might be regularly on 15, 18 or whatever, and that might be deemed as high, but that might be they might just have lots of testosterone versus someone that might have 9 and might be able to function perfectly fine on 9.
Yeah.
And that just adds to the confusion of an already confusing picture, and that just adds to it, doesn't it, unfortunately?
Yeah. And I think that's the problem. You've nailed it in the head. You know, they don't look at, you know, as the individual. And I know it must be hard for them to do that, but they talk about holistic care so often. And you have this area where it's like, okay, we've got these numbers for this guy. You can't base it on, you know, somebody who's got 2 normal functioning testicles, let alone somebody who has had that and then doesn't have that as well. You know, it's such a knife edge. And I think there's not... I understand the pressures that doctors are under, because it's like these appointments that I don't know what it's like down in Essex, but you know, it's like 15-minute, 30-minute appointments max type thing to try and get to the bottom of something, and then that's it. And it doesn't help, you know, when they're under that amount of pressure. But at the same time, they're not looking at you as the individual. It's just like you say, the numbers on a page.
No, exactly. I got to the point where I because the GPs sort of didn't want to commit, I got to the point where I stopped asking my GP about this and just started pressuring the hospital. And my poor CNS nurse, you know, I regularly was in contact with her, asking her about things so that she could try and ask. And the CNS nurses were just absolutely brilliant, because, you know, you had that level of contact between the 3 monthly appointments, because unfortunately when you have those 3 monthly appointments, it seems like such a long time away if you have a question, and you know that unfortunately your GP doesn't, you know, your GP might have seen 2 testicular cancer patients in his whole life. You know, they don't see many people, let alone deal with the hormones afterwards. You're almost better off just going, well, let's not do that, let's not bother with that. But I think from seeing Siobhan and Michelle in the cancer support group that we set up, they were working at Bart's and doing a lot of stuff with Bart's in London, and they were talking about the sort of blood test beforehand and trying to get an idea of testosterone beforehand as well, which is good, because at least that way they're sort of looking at this and trying to preempt any issues, which is you know, a good step in the right direction, isn't it?
Yeah, and I think these things move forward because they've got guys like yourself who are comfortable in saying, no, this isn't right, you know, and to be able to kind of, like, you know, start these groups and to say, listen, this has been my journey, and the only way that things can change in terms of, especially like you say, men's the thought process around men's hormones, because I don't think people really think of that in general. It's like, women's hormones certainly are talked about more openly now than they ever were, in a really positive and exactly the same way. But again, it comes to that stigma around men's health, and testicular cancer still rarely spoken about, even educated on, in men's hormones like testosterone. And I think there's sometimes you get looked at, when you maybe talk about testosterone, it's like, oh, you just want to go into the gym and push weight. It's like, no, I want my brain to feel normal.
I want this brain fog to go away, please.
Yeah. So see, within your kind of low testosterone journey as well, what are some of the symptoms, apart from like obviously your low mood and things like that? Have you had any physical symptoms of that you can describe for us?
Well, I suppose the physical symptoms, I guess, is just the lethargicness.
Mm-hmm.
I guess. I mean, just having no interest in wanting to do anything. I mean, the weird thing is that when you actually do exercise, you do feel a little bit better, but it's that trying to get going. Mm-hmm. There's just no interest in trying to get going. There's no interest in trying to do anything, and no focus. That's it, and it's just trying to do anything. But I mean, I didn't really notice any physical things apart from, like you say, the sort of like the putting the weight on.
Brain fog as well.
The brain fog was terrible. Absolutely terrible. Yeah. I mean, I just didn't know, and just feeling a little bit agitated. I mean, I literally felt. I mean, I know it's again a sort of very rubbish analogy, but I got to a point where I was just feeling a little bit like the day before you're about to go on holiday and you've got all that million thoughts all rushing through your head. Have I forgotten anything? I forgot. And I never ever. I felt like that every day, like I was forgetting something. And I started to write down post notes around the house just because I just was forgetting everything.
Yeah.
I was literally, I was taking the mick out of my old nan, bless her, before just doing the sort of old nan thing where you walk up the stairs and you forget what you walked up the stairs for. And I'm doing this as a man in my 30s. I've just got, and actually forgetting what I'm saying midway through a sentence. Mm-hmm. It got that bad. It just. I'm just pleased that I remembered where I lived at one point. Just almost have a label if found, please return to, and have my wife's mobile number on there. So it was, you just forget everything. It was just terrible. But I mean, the thing that helped me is that I went on to. I'm now on the Testosterone injections, having them every 3 weeks, and although it's a pain because I've got to go down to my GP every 3 weeks. And they get sick to death of seeing me again. It's me again. But that really stopped the massive peaks and troughs that I was getting.
Right.
So it gave me a sort of a much smaller peaks and troughs, and that was the game changer for me. Complete and utter game changer. Just incredible. It wasn't, and I think the problem and the other message I think is good to get to people about testosterone replacement is it's not an instant fix. Unfortunately, as soon as you get to that dot, I mean, I remember walking out the pharmacy just to go home with my wife with my first can of Testosterone, and we're like, yes, here we go. Put it on in the morning, and just almost sitting there waiting for me to be, yes, I'm cured.
Yeah.
And it doesn't work like that. Unfortunately, it's a very slow process of starting to feel better, and particularly with injections. It's almost like you need to get a few cycles in you before you start feeling either worse, in my case with a libido, or better with the Testosterone. But I mean, the other thing as well, I've had some really strange other side effects with the hormones as well, which I mean, I talked to the nurse at Orchid, Rob, quite a lot when I was going through this.
I met Rob at that conference.
Oh, did you? Yeah. Well, I mean, at the time, I think he was sick to death of me. He was like, "Oh, you again." Bless him. He was so patient with me, doing some research and helping me. And I had some really bizarre symptoms afterwards. I take thyroxine now every day,
right?
Because I've got autoimmune thyroid disease, which again I never had that before I had cancer. So whether that, and I think Rob said he's found a few people that have had something like that after was. Mess one hormone up, and it seems to have a side effect on others, maybe. Because after I got this Testosterone, I started to feel a bit better. I then started to sort of like, something still isn't right. I still don't feel great, especially in the mornings. Wake up in the morning, I'm still struggling. And I went there and I saw an endocrinologist. They referred me to UCLH in London at a point because more specialists than my local hospital, and they did a full thyroid makeup on me, and then they said, yeah, this is the problem you've got at the moment, and they gave me thyroxine, and I take that every morning, and that was again the next level of wow.
Yeah.
Just incredible. And I've also got reactive hypoglycemia, which I never had beforehand, which is insulin, which again is a hormone. I never had that beforehand. I would quite happily drink beer, eat chocolate, drink Coke, loved orange juice. Anytime I could get my hands on orange juice, just gulping that down. Can't touch any of that stuff now because the body just goes into freak out mode. Again, that was a thing that I've got since this as well.
Right.
So,
Which is incredible to think, that there's maybe a ton of guys out there maybe experiencing one, if not a couple or all of the same things, but would maybe never put it down to having their testicle removed and the impact of low testosterone and hormone levels as well.
Yeah, absolutely bizarre. But you just keep feeding these things, and I had various, when you go and have the sugar tests. Mm-hmm. Had various ones of those, had extended ones of those where you're in there for 5 hours and they give this little sweet thing and they want to see how rubbish they can make you feel before they let you go. and then in the end they said, yeah, you've got this. This is why you don't feel great after you eat certain things. But the problem with me is I was doing the thing of, I feel crap today. Let's get a nice bottle of full sugar Coke and don't gulp that down, because that'll make me feel better. Because that's what you still know as younger. Got a hangover, full fat Coke, job done. And what I'm actually doing is I'm actually chucking a bucket of petrol on a fire, aren't I? I'm actually making it worse. And that's like, at the time, I was like, yeah, full fat Coke, you always sweat. That's always good. Good for everything, isn't it?
Well, up here it's full fat iron brew, So.
Oh yeah. Good, nice bit of iron brew for breakfast. That'll sort you out with it. So,
And I agree with you though. You get times when you hit that sugar rush or that high. You go, oh, I'll just take carbs, and you're like this. Falling asleep, and feel rotten. Because of that as well.
Yeah. But that's why I go. So I have to be a little bit careful of what I eat and drink now, because I've stopped drinking. I'm drunk for 8 years now. Because
as an alcohol,
completely stopped drinking. Yeah, just purely from a health point of view. I wasn't. To be fair, I wasn't a massive drinker anyway. I wasn't. Not. Because I was, like I say, when I had cancer, I was 35. So by the time I was going for this, I was in my early 40s. So you get to that point when you got kids and that, it's not like you're out every night on the lash anyway. Do you know what I mean? So I wasn't a massive drinker anyway. So it didn't really affect me too much. Not like asking a 21-year-old to stop drinking or anything like that, I was going to ruin my life. So, it wasn't. But because that was just making me feel worse as well, because of the way that alcohol and sugar go together, and you just get to that point where you have 4 pints on a Friday, and felt rough for the whole weekend. And it wasn't just because of me being a lightweight; it was this thing.
there was a genuine reason for it.
Yeah, exactly. I don't miss it too much, but I just miss it when you go out and your mates are repeating the same story, and you're like, oh no, I don't like being the only sober one in the group. Is not fun, is it?
I stopped drinking for must have been about 2.5 years after treatment, just because. I think I tried to have a drink and woke up feeling hungover, and it just made me feel like. I was feeling like when I was going through chemo, and it just put me off. So it took a long time for me, and being the sober one at the party is always interesting. I'm lucky at times that I'm gregarious enough that I don't need to have a drink in me to talk rubbish, but it's just the friends talking the same rubbish to you for the third time that night. It gets a bit boring. Or it's the kind of arm round the shoulder and the kind of alcohol. I love you, man. I love you.
You're
like, okay. It's time for me to go home.
Exactly. I don't love you being this close. Go away.
But so have you over the time of kind of like having like your kind of your testosterone treatment and feeling with those kind of like low mood and things like that, what kind of resources or strategies have you used to kind of help with that? Have you used anybody or anything that's made you feel that you could talk about it and feel a little bit better?
Yeah, over the years, I've had a couple of sessions of talking therapy face to face with people. Hospital suggested as well at one point to do CBT. I like the idea of CBT, but I think at the time that I went for it, I was in such a brain fog moment. I couldn't really. I think with CBT, you have to have a certain amount of clarity to recognise that you need to help yourself. Whereas
Yeah.
I think they sent me to that, and I was just in such a dark hole that I couldn't get my head around how to use that properly. I can understand it as a tool, and I can see how it works for people, but I think at the time it was the wrong thing to me to do. And I've been put on antidepressants as well after I had Sustanon, because I was in such a state, and it just sort of helped with the ups and downs. Really low dose of sertraline, but I think with the thyroxine I was moved on to citalopram, I think it was.
Yeah.
Really low dose, but they work with a thyroxine, whereas the other ones didn't. Right. It just takes the edge off slightly of the ups and downs. And again, there's no stigma around that. It helps. So you do what you do to help, don't you? Because at that point, you just get to that point where you are so fed up with it, and you want to get back to a normal life, and you want to be normal at work and with your kids, that you just fed up with treading water all the time. You actually want to today I want to get up and actually be proactive and not feel like I'm just treading water all the time. So combination of the Sustanon and the thyroxine, and then having these just actually made me feel like, for the last 4 or 5 years I've actually felt like I could actually almost back to being a functioning adult again, which is after spending so long just literally treading water and going through the motions. And
I think that's one of the big problems that you find as well, even amongst, see when you look online and social media, and again, that's still that misunderstanding of kind of mental health, and then how physical health will impact that. You can you'll see these big podcasters or health gurus talk about SSRIs, which are the antidepressants that we've been on, how bad they can be, and it's like all you have to do is eat right, exercise, and it's like, I know this. People can look at you and go, but you look all right. There can't be anything wrong. It's like, but there is. There's just nobody can see it, and I think I think that struggle's real, and I think that having conversations like this and being able to kind of have guys not just talk about their testicles, but talk about their feelings within that, and to then help, because it could be that, like, well, why am I feeling so down and I've done everything right? And you go, well, it could be that you've got low testosterone, or that this other thing's happening, but we have to create an environment for men who have had testicular cancer to feel safe, feel heard. And I think, podcasts like this, and I know I'm kind of blowing smoke up Cahonas here, but we are really trying to kind of do that, so that, somebody doesn't necessarily have to come on here and talk about it, but they might listen to your story and go, oh, Dan's story totally resonates with me. I need to explore that.
Definitely. That's if you can help someone, one person you can help who's going through some of this, and actually say, look, I was in the absolute bottom of this, and through perseverance and trying to take one step at a time, one day at a time, and then getting on to the right things, and then every time you don't feel right, just keeping on, and the fact that charities like yours are actually putting that message out, and then there's more awareness around that, there's more thought about the aftercare, because it's not just, like you say, I cannot fault the speed at which my cancer was dealt with, and the chemo and that care was absolutely incredible, incredible, and they just were 100% brilliant. They were just, everyone was brilliant the whole way through that, and the CNS nurses were fantastic afterwards. They did what they were there, always there for me to help me, and the whole thing was brilliant. But it's then we don't experience people with testosterone problems very often. We don't then experience what effect that has on your mental health. And your physical health, and when you feel like crap, like you're saying, and you've got zero motivation, then when you got zero motivation, I will eat and drink crap. which is completely opposite to what I'm not going to go and do myself a nice bit of grilled chicken and steam some broccoli. At that point, I'm going, right, let's get down to Five Guys and have the biggest burger I can find.
Yeah.
So and that probably goes against you need to eat healthily and go and do some exercise. It's like, no, if I feel shit today, I'm going to go for a takeaway.
Yeah, I'm going to eat Chinese food and eat Haribos. That's
Exactly. Yeah, then you start putting weight on, which has a detrimental effect to your health as well. And then you don't do exercise because you get up the next day and you always feel a bit groggy after you've had a Chinese or something like that anyway. And you feel, quite often, I always feel more hungry, and then eat more the next morning and eat more crap, and it's like a sort of a cycle, isn't it? And it's very difficult to then go, right, well, let's go and let's eat healthy today and let's do some exercise. Yeah, that's what I need to do.
Yeah.
People are always going to have opinions, aren't they? There's always going to people on the other side who don't understand will always have an opinion and always wanting to pipe in with some much needed advice.
Yeah.
I do love a bit of advice that starts with "at least," because it's always going to be really good advice if someone says that, doesn't it?
Yeah. Well, at least,
at least,
so
That's as soon as someone says that, you just need to go, stop. I don't want to hear it. Whatever it is, keep it yourself.
It could be worse.
Yes, that as well. That as well. Yeah, exactly. Yeah.
Yeah, and you're sitting there going, I know it couldn't be. For me, relatively, that's the thing. It doesn't. I suppose it's like the struggling with the kind of these, like be it anxiety, low mood, depression, and how people are kind of manage these feelings. What advice would you give to you, 8, 9, 10 years ago when this all kind of started? What advice would you try and give yourself now?
Bloody hell, that's a good question. I guess I'm a terrible patient. Terrible patient. And I guess probably to not be so hard on myself and get up the day and go, right, you're feeling rubbish again. Oh, it's your fault. And I'm a bit sort of self-critical anyway, and I think that just gets you into a bad place. So I think to be a bit more patient with myself, because I think what I do at sometimes is try and push myself too hard, and then you'd actually get to the point where your body wasn't up for it. But patience. Maybe try to understand how it looks to the people that are around you, rather than getting more angry with them because they don't understand.
Yeah.
But when you've got massive brain fog, you're trying to put one foot in front of the other, let alone see how someone else looks at you. So again, that's probably really poor advice from the outside, isn't it? But just getting angry, people don't understand. I just got so angry with everyone that just had no interest in trying to understand why you're feeling that way, and why it's taken so long. A bit like people at work that sort of say, how are you feeling today, or how are you, and you start explaining, and then they look uncomfortable, and you're the one that ends up changing the subject because they don't really want to know, they're just being polite. Exactly. Yeah, that's what you do in the end, don't you? You just lie and put this mask on, don't you, that says you don't even want to know what I'm thinking at the moment, let alone for me to try and explain it to you. So I guess probably to be more patient with myself.
Yeah,
I think,
and I think that's a good thing to want to kind of be to be with yourself as well, if you could say that. And you might not always. It'd be great, looking back for me as well, to be able to go like, just take a pause, take a beat, and allow your feelings to kind of surface, or allow people to think the way they think. But it's trying to not be that reactive way to some of these situations as well.
And to have some time for yourself as well. I mean, you've got to try and make, in that patience, you've got to try and make time for yourself. Because I think it's very easy, and I know that I'm one of these people that likes to be busy all the time, and I'm terrible. My wife and kids always say about, why don't you just sit down and relax? And I'm like, I want to be doing something. And I think sometimes when your head's not in a good space, you want to keep occupied and busy, because I don't want to sit down and relax, because I might start thinking more.
Yeah.
And then by being busy, you're sort of tiring yourself out. So it's kind of almost like a different, a kind of vicious circle. But And I think as well, I went for a phase. I haven't been out on my bike much this year, but I went for a phase. I love mountain biking. There's a great place near me, Danbury Common. Got some little jumps and downhill on the bike. It's not like one of these big bike parks, and it's certainly not Fort William. You see the way they fly the mountain bikes down there, but it's got some nice little jumps. And I got to the point when I was feeling rubbish. That was my escape.
Yeah.
And I got to the point when I actually was jumping more and do so, because I got to the point where I was quite reckless, because I just didn't give a shit. Do you know? Because I felt so bad. I was actually getting to the point where if I crashed in hospital, it might give me a bit of peace and quiet for a few days. I might be able to get away from stuff. I just got to the point. It was quite bad, really. And I've heard of people. I've listened to other things in the past where people say that when they're quite low mood, people can get quite reckless. I know that wasn't very, I wasn't taking drugs or kind of drinking binges, but I literally was getting to the point where I was like, right, helmet on, let's go for it.
Yeah.
It's like, tree? That's fine. That'll be all right. I'll bounce off that. Getting to the point when I was like, no fear whatsoever, which, is quite weird the way the brain works, though, isn't it? How that is. It's quite a strange feeling.
The human brain, it's so complex and so like you'll know yourself in these studies, it's barely scratched the surface how it can make us work. So I think it's when it comes to stuff like that, I get that completely. And
the waking up in the middle of the night and going into full overdrive mode was the other thing that's plagued me for years as well. That was horrible. Getting almost a bit insomniac kind of style. But,
Or waking up at like 1:30 a.m. and that's you,
Yeah. And you walk around the house thinking that you woke up sometimes in such a jolt that I'm sure that someone must be trying to break through the window or something. And you walk around and it's like, nothing's happened. It's just my own head. And then by the time you've done that, I'm wide awake. Yeah. Not going back to sleep now. And very, very, very frustrating. But
definitely. And so as I've kind of seen online, you're a big advocate of testicular cancer awareness, mental health awareness as well. How do you see like just your future within your own survivorship and like the next 10 years? It's been 10 years or plus now since your diagnosis and treatment. How do you see yourself in the next kind of 10 years with your awareness and your ability to communicate your story? Is that something that you look to kind of do more often, or is it are you just happy kind of sharing things like that?
I'm not a great public speakery type person, and I've done a couple of talks for Movember online, and I'm happy to help people in our support group whenever, and keep on to various charities like Orchid, and keep sort of saying to them, Rob's always at these meetings as well, like keep banging and drum for the post care. That's what I'm would love to keep doing, and that's why I'm still doing that. And anyone that wants to, I'm happy to talk to anyone that wants to ask about it or is going through bad journeys with testosterone. But I haven't done anything outside of that really wider thing because, like I say, it's time and not being a very good public speaker. That's a big problem, isn't it? More than anything else.
I think what you do anyway, and within the Facebook group and all that, and people being able to kind of reach out and like the way that we've connected and be able to kind of connect to do this podcast as well is that's a massive thing as well. So I'm grateful to you for that as well, and apologies for bursting into tears.
No. I've been like that for a year. I know exactly how you feel, and I know exactly how you feel, and I hope you've got someone that you can bang on to about that. And get what you need. And like I say, now that we've connected on Facebook, if you want to have a chat about this anytime, or phone me up and pick my brain about how I went through testosterone placement once you get there, or just to chat and talk rubbish, happy to help whatever way you want, because it's an awful feeling. You don't want to be there, and you got family you want to think of, and
No, I appreciate that,
it's
mate.
not easy.
And
It's not easy.
I'm the same, like if you ever need a chat, somebody else is just there, so yeah. Thank you so much for coming on, Check 1 2 as well, and I'm so glad we managed to get this over the line as well. It's calendars can be difficult, as we said at the start, but it's been a great chat, and I'm really grateful that it's kind of been based around the mental health aspect of it and the testosterone aspect of it, because it's something that we haven't really went into too much depth with. So thank you for being so open and honest about all that as well.
Yeah, no problem. I've subscribed to you guys a little while ago in Spotify, and the other week when we arranged this, I listened to the last 3 because my to-do list on Spotify podcast is about 80 waiting. I subscribed to them, download them, and go, I'll listen to that, and then realise you've got about 1,000 hours. So listening to Andy's one, Tracy, and sorry, I've forgotten the guy that was the rugby guy before that.
Brian.
It was just brilliant, absolutely brilliant.
Yeah.
I met Tracy a few years ago because
nice.
I'm a West Ham season ticket holder. Just after they moved to the new stadium, she did a DT38 awareness walk from the old ground to the new ground. So we went on the walk with her. Met her, and she gave DT38 t-shirts to my kids, and it was lovely lady and fantastic what she's doing. For the awareness, and listen to Andy doing his mental 100k runs. Just wow,
unbelievable. Definitely got more motivation than you and I.
Wow, yeah. If I go out for a walk and it's 5k, I'm happy. So exactly. That's a long walk. So just incredible. Listen to some of the other people you've had on there. It's brilliant. They're doing the awareness. So I was like, we're talking about testosterone and mental health because they're all very much banging a drum around the awareness piece, and that's great as well.
Yeah,
so
thank you so much.
That needs to be done. So it's great. So keep up the good work. The podcast, brilliant.
When life is difficult, the Samaritans are here day or night, 365 days a year. You can call them for free on 116 123 or visit www.samaritans.org to find other ways to reach a Samaritan. Remember, you're never alone.